Hey everybody, my name is Bethany Little Page. If you've seen on our course, it's usually under Grace. I go by my middle name. And today I'm going to be discussing access to mental health care in rural Kentucky and the role as a psychiatric nurse practitioner. So, rural Kentucky continues to experience significant mental health disparities. Many counties in our state are designated mental health professional shortage areas, meaning there are not enough providers to meet the needs of the population, and in some areas, none at all. Patients often face long travel distances, limited specialty resources, poverty related barriers, and stigma surrounding mental illness. These challenges can lead to delayed treatment, worsening symptoms, and in many cases, a preventable crisis. Because of these gaps, psychiatric mental health nurse practitioners are increasingly serving as essential providers in these underserved rural areas in Kentucky. An analysis of the problem, you can see here many counties designated mental health professional shortage areas, long travel distance for care, limited crisis services, and broadband gaps affect telehealth as well as unequal provider distribution. So, when we take a deeper look into this issue, there are several structural barriers. The provider shortages means patients may wait weeks or even months for their appointments. In some areas, there may be no psychiatrist available at all. And in those situations, patients are required to rely entirely on primary care providers, or sometimes they go without care altogether. Transportation barriers. Many patients must travel long distances for care, which is difficult for those individuals who have limited income or unreliable transportation. The broadband limitations affect telehealth access. While telepsychiatry has expanded significantly, not all rural patients have consistent internet services or availability to the technology they have to use to um, take advantage of those services. And then finally, the workforce distribution remains uneven. Even though there are psychiatric mental health nurse practitioners growing nationally, rural areas continue to struggle with recruitment and retention. These factors collectively contribute to health inequalities and reduced access to timely mental health care. So, what the evidence shows, literature strongly supports the role of psychiatric mental health nurse practitioners in addressing these disparities. Research shows that nurse practitioner led mental health care produces outcomes comparable to physician provided care. This reinforces that psychiatric mental health nurse practitioners are fully capable of managing complex psychiatric conditions. Integrated behavioral health models, where nurse practitioners are embedded within primary care settings, improve coordination, increase early intervention, and reduce fragmentation of care. Telepsychiatry has also been shown to significantly improve access to rural communities by reducing some of those geographical barriers. However, workforce distribution challenges and infrastructure limitations must still be addressed to ensure equitable, equitable access. Plans to improve access. To advance mental health care delivery in rural Kentucky, several strategies are necessary. First, we want to focus on expanding telepsychiatry infrastructure. That includes improving broadband access, ensuring reimbursement is available for telehealth services. Secondly, we want to strengthen the integrated behavioral health models that allow psychiatric nurse practitioners to collaborate closely with primary care providers to improve continuity of care. Third, workforce development initiatives such as loan repayment programs, Rural incentives and mentorship opportunities can help recruit and retain psychiatric mental health nurse practitioners in underserved areas. Policy advocacy for full practice authority and telehealth reimbursement is essential to sustain rural psychiatric mental health practice. Finally, community education and stigma reduction efforts are essential. Increasing mental health literacy encourages earlier help seek earlier help seeking behaviors and reduces shame associated with treatment. In conclusion, access to mental health care in rural Kentucky is a complex system level issue influenced by workforce shortages, geographical barriers, and socioeconomical disparities. Psychiatric mental health nurse practitioners play a vital role in addressing these gaps through direct patient care, telehealth, leadership, and advocacy. Improving rural mental health outcomes will require innovative care models, policy support, and sustained investment in the advancement practice nursing workforce. Here you can also see my references. And then discussion questions. To encourage further discussion, I would like to leave you with two questions. First, how can psychiatric mental health nurse practitioners balance clinical responsibility with leadership and advocacy roles in rural communities? And second, what strategies can ensure the telehealth expansion improves access without unintentionally increasing disparities related to technology issues? Thank you for listening, guys.